Ladies and gentlemen, boys and girls, welcome to my YouTube channel and yet again another video. Your presenter here, IDE Henry, here to take you through the management of pneumonia. Alright, so without wasting much of your time, don't forget to hit a like and sub and subscribe. Let's go straight into the questions. I have a question with me and my question reads, a 32-year-old man with history of nasal flaring is admitted to your ward with severe pneumonia. All right. Question A, B, B2, C, and lastly, I have a number of questions with me here. We're going to define pneumonia. We're going to state 5 predisposing factors, a well-labeled diagram. We're going to identify 5 problems that this patient may face during hospitalization. And we're also going to solve those problems using a nursing care plan. This is a 50% marks question, and this, I assure you, you can get all these marks if you pay attention to this video. And also, we're going to discuss 5 points in the information, education, and communication that we're going to give to Mr. Pajaji on discharge. Let's begin. Pneumonia can be defined in the following way: as an inflammation of the lung, parenchyma, caused by various microorganisms, including bacteria such as mycobacteria, fungi, and viruses. It is characterized by persistent, productive, purulent cough and fever of 39 to 40 degrees Celsius and cyanosis. That's how you define pneumonia. Let us list 5 predisposing factors. So let's pay attention to the question. The question says list. It doesn't say state or mention, it says list. So definitely you're just going to list them without explaining them. We've got decreased consciousness. All right, so if we reverse back to the question, we're just listing and we're not explaining because the question is just 10 marks, as we can see there. So quickly: decreased consciousness, cigarette smoking, viral, upper respiratory infections, intestinal and gastric feeding, alcohol intoxication, and the like. Decreased consciousness can cause pneumonia in the sense that the respiratory center is depressed, and once the respiratory center is depressed, this impairs the coughing reflex. Hence, there will be accumulation of secretions in the airway, and this is going to result into pneumonia. Okay. Then cigarette smoking cigarettes impairs ciliary action. The cilia found, or the hair-like structures found in the airway, are responsible for expelling all foreign substances as well as mucus from the airway, keeping the airway clear and clean. But when you smoke, this impairs the function and the mechanism of ciliary action. Hence, this will lead to pneumonia. Viral upper respiratory infections. These can include any viral infection that can cause gene mutation of pneumocytes, which are the cells found in the alveoli, as well as those that will lead to chronic inflammation, and the chronic inflammation leads to lung insufficiency. Hence, this will result into pneumonia. Also, intestinal and gastric feeding. What does this do? Too much of gastric feed using an NGT or a nasogastric tube can cause aspiration, and once that gastric content is aspirated, this is going to go into the airway and it will be stagnant. Hence, this is going to lead to pneumonia. Then we've got alcohol intoxication. All right, so intoxication is going to lead to decreased consciousness, and once a person is intoxicated, it means the respiratory center is also going to be depressed. Hence, it's going to cause the problems I earlier mentioned under decreased consciousness. Let's proceed. Identify 5 problems that Mr. Pajaji may have during hospitalization. This is 5 marks. We're just listing. The first one is ineffective airway clearance, fluid volume deficit. For most of you who think dyspnea is a problem, dyspnea is not a problem. Dyspnea is a manifestation of ineffective airway clearance. All right. And then fluid volume deficit is the scientific way of mentioning dehydration when you're writing a nursing care plan. Also, impaired thermoregulation. In case you want to put fever as a problem, impaired thermoregulation is how you should write it. Anxiety, and lastly, risk of hospital-acquired infections, also known as nosocomial infections. With the 5 problems identified in Part C, write the nursing care plan that you would institute during his hospitalization. I'm going to take my time here and we're going to explain this in a nice and fashionable way. Right? Okay, so what are we starting with? The first problem we had in our case was ineffective airway clearance. This problem itself, identifying the problem, is 1 mark. Explaining the nursing diagnosis is 2 marks. This is also 2 marks, 4 marks, and lastly this is 1 mark. Everything altogether is going to amount up to 10 marks. Quickly, ineffective airway clearance, the nursing diagnosis is ineffective airway clearance related to increased tracheo-bronchial secretions evidenced by dyspnea. Right? Objective. Your objective should be SMART. S-M-A-R-T. S stands for specific. That is why we have the sentence starting with the patient. M stands for measurable, meaning the interventions that we're going to put into play should be measurable. And then A stands for achievable. Everything that we've listed here can be attained. R stands for realistic. We're putting goals that are real and scientifically proven. And lastly, time-bound. Like I have expressed earlier in my objective, my interventions will be done within 2 hours to reach our goal. Great. First intervention. I will humidify air by boiling kettle to loosen secretions. This is going to make the secretions easy to cough up. I will encourage hydration to loosen secretions. Same applies with what's in the first statement. I will teach coughing exercises to clear the airway from secretions. This is going to help the patient best expel those secretions by teaching them coughing exercises. Also, I will perform postural drainage and chest percussion to remove secretions. This postural drainage means the patient is going to be positioned in an inclined position that is inverted, meaning by the help of the force of gravity and the humidified or liquefied secretions, this is going to help the patient easily cough out the secretions and clear their airway. How do we evaluate? The English that we had used in our goal plus our evidence is supposed to appear in our evaluation. Our objective is in future tense and our evaluation should be in past tense. The patient has effective airway clearance within 2 hours of nursing care evidenced by absence of dyspnea. While in our nursing diagnosis we had presence of dyspnea. We proceed. Our second problem is fluid volume deficit. Alright? Fluid volume deficit. What's up with this problem is most people write dehydration, but you're not going to be given a mark for it. The best way to write fluid volume dehydration is by writing fluid volume deficit. Great. Fluid volume deficit related to insufficient intake and profuse sweating, which is secondary to fever, evidenced by poor skin turgor. All right. Our objective, it should be SMART as I earlier mentioned, so the patient will have improved and balanced fluid volume within 24 hours of nursing care. So fluid volume is not something you can solve in 10 minutes, 30 minutes, or 1 or 2 hours, but it's something that can be changed gradually. Interventions. I will encourage oral fluids to restore fluid volume. I will establish an IV access for fluid administration, that is a cannula. I will administer intravenous Ringer's lactate to restore fluid volume and lost electrolytes. I will record intake and urinary output to prevent fluid volume overload. Alright? To prevent fluid volume overload. Then, evaluation. The patient's fluid volume has been improved and maintained within 24 hours of nursing care, evidenced by good skin turgor. Without wasting much time, we quickly go to the next problem. Impaired thermoregulation, aka fever. Pneumonia is an infection, and an infection is characterized by rise in temperature. So impaired thermoregulation is a problem. So impaired thermoregulation, which is related to antibody-antigen reaction, evidenced by temperature of 38 degrees or 38.0 degrees Celsius. Our objective should be SMART as usual. The patient's body temperature will be reduced by 1 degree Celsius within 40 minutes of nursing care. Right? Then we proceed. Pardon my misspellings over there. Our interventions read, I will check the patient's temperature to create baseline data. Secondly, I will open nearby windows to promote heat loss by radiation. Thirdly, I will tepid sponge the patient's body to promote heat loss by convection. And lastly, I will administer prescribed antipyretics to reduce and relieve fever, such as paracetamol, ibuprofen, acetylsalicylic acid, or diclofenac, right? And our evaluation reads, The patient's body temperature has been normalized and reduced by 1 degree Celsius, evidenced by a new reading of 37.0, which is within the normal range. Also, another problem is anxiety. So we have already 4 actual problems. We had impaired thermoregulation, ineffective airway clearance, and lastly, fluid volume deficit. Anxiety is another actual problem. Then lastly, we're going to conclude with a risk problem. So anxiety related to unfamiliar ward routines, evidenced by patient repeatedly asking questions. So the patient will be allayed of anxiety within 4 hours of nursing care, and your interventions will be as follows. Firstly, I will allow the patient to ask questions and express concerns to allay anxiety. All right. Secondly, I will orient the patient to ward environment, equipment and tubing to allay anxiety. Thirdly, I will explain all procedures done to allay anxiety and promote cooperation. Fourthly, I will allow the patient to be with their support person to promote a feeling of belonging as well as allay anxiety. And lastly, the patient has been allayed of anxiety within 4 hours of nursing care, evidenced by cessation of repeated questions. That's how you write that. And our last problem in our nursing care plan is that of risk of acquiring hospital infections. So these hospital infections are acquired when a patient is hospitalized. Every patient who's hospitalized is at risk, so this becomes a problem. Our nursing diagnosis. The risk of acquiring hospital infections related to hospitalization. Our objective. The patient will be prevented from acquiring hospital infection throughout hospitalization. Our interventions. The first one, I will wash hands at all intervals of nursing care to prevent cross-infections. Number 2, I will change the patient's linen whenever soiled to prevent infection. Number 3, I will perform assisted tub baths and bed baths on the patient to prevent infection. Number 4, I will administer prescribed prophylactic antibiotics to prevent secondary infections. Having done that, what will our evaluation be? The patient has been allayed of anxiety within 4 hours of nursing care, evidenced by cessation in repeated questions. This is supposed to be an evaluation for anxiety. So the patient has been prevented from acquiring hospital infections throughout hospitalization. Pardon me for that typo there. Having done that, ladies and gentlemen, other problems that may apply for other respiratory conditions, I have listed them. You can pause the video to write them down quickly. Others that we did not include activity intolerance, fluid volume deficit is there, knowledge deficit, compromised nutrition or nutritional imbalance, impaired thermoregulation, chest pains, impaired gaseous exchange, and lastly, ineffective breathing pattern. We proceed. Discuss 5 points in your IEC that you would give to this patient on discharge. Firstly, tell them to avoid irritants. So how do you write this? Make sure you head each point. You write a heading and a number because you've been asked to discuss 5 points, right? So the first point is avoiding irritants. I will explain the postural drainage, percussion, and vibration to help mobilize and remove mucus from the lungs when the patient is at home. All right? Importance of hydration as your second point. You write the heading like that and underline it nicely. I will advise the patient to be drinking 2 to 3 liters of fluids a day to maintain adequate hydration and keep mucus secretions thin for easier removal. Ladies and gentlemen, chest physiotherapy. So I will explain postural drainage, percussion, and vibration to mobilize and remove mucus from the lungs. And you can talk about the importance of hydration, a well-balanced diet, and the like. With those explained, ladies and gentlemen, this marks the end of our question.